All right.
The last one was 94. But
Okay. So,
I couldn't, I'm trying to go back to review them. It's like they have
okay.
closed. I couldn't see them again.
So, here's the thing, Joy. Let me actually go in the quiz. Would you be so kind if you want to? Absolutely, you don't have to. Do you mind if I share your login so I can walk in as you?
Yes,
Now, I would be sharing with other people here because the purpose for them to learn. Is that okay? If not, it's totally fine. I can just log in as myself.
oh, go ahead.
So go. I mean, I'm sharing new information. I don't want this to
Go
be,
ahead and
invasive.
I'm good with that.
Okay, so go ahead. Please give me your email address.
My email is
Just put in the
okay.
chat box while I am logging in here, and then I want to show everybody why she may not be able to see it. And I am assuming you took this test maybe in the last 10 days, right?
Yes, sir.
Okay,
I
so
think
perfect. So this is a perfect scenario. If you don't mind, I'll share your screen. I'm going to log in as you. If you can put your email address in the chat box here, while I'll get my stuff here set up. And then I'm going to share what is the point of confusion. Um, while you do that, Joy, kind of go ahead. I'm waiting for you, okay?
yes,
You know
sir.
where the chat box is at?
Yes, sir.
All right,
I
thank you,
did.
Joy.
Mhm.
So I'm going to ask permission to join as you, so that way I'll be Joy for a day here or for a minute. Okay, so let me log in into the system. The system is going to say, hey, I want to ask permission, log in as the user. So since you give me permission, I'm going to log in as you. Okay, so here is Joy's screen. Okay, and I don't know if this is what happened, but I have a strong suspicion, right? So I log in as Joy,
Mhm.
and I see that she took some diagnostics here, but I bet she also took some here in the question bank. So the diagnostic tests are located in two places, inside of your question bank
Mhm.
and the one screen on the side. If you took your test on the screen on the side and you go back to it, you're not going to see it. So here I see that diagnostic test 1, she did not take it here. She took diagnostic test 2, great score, and you guys can see it that she took only once, so she will pass the board. Okay, and then if you go here to diagnosis 3, you see it that she took once and she got 85. Now where's diagnosis test 1 and 2? Now let's go back here to the top of the screen and go back to start. Okay, always go back to start, everyone. Please do not go to course, go to start. And then let me go to the other the other ones that she did, which was here. So she likely took two tests in two different locations. And that is the reason why she may not be able to see it. Remember
Mm.
that she didn't have test 1. Now she does. Look at that. Joy is killing it, man. And you can see that she only took it once. So she's really not trying to play around. She took it when she was prepared. Joy, you have absolutely nothing to worry. You're the next PMHNP. I'm telling you, right?
Amen. Amen.
Amen. You can mark my words. Okay, you are
Amen.
the next PMHNP. I don't know when you are taking. So everyone, when you ever go back to any page and you don't know where you are, go to start. Okay, go to start, and then you go back to the home page, and then you can go back to your screen.
Okay.
So everybody kind of understood why she didn't have all her tasks in one location, right? Because she took it in two different locations. Okay, so the system is kind of like separate You have everything because you are in the main course, but some people only get the question bank. Some people only do the diagnostic test. And that's why we have set up that way, hopefully trying to decrease any confusion. But if you are going to take the diagnostic test, take it in one location so that way you have all your scores in one location, whether you do it from the question bank or from the main, you know, four tabs here that you see it here in the middle of the screen. Okay.
Okay.
Now I have recently, I believe, I have recently updated diagnostic test 2, and I believe I did it from here. So it would be wise for everyone just to use this block of information. Once I update something here, it does not cross over to the question bank diagnostic test. Okay.
Yes, sir.
So why I
Professor,
did that? One second, my man. Why I did that? Because a lot of people asking for the rationale. I lose sleep over this because I think it's very important if you do it early to look up the answers, because when you do that, you learn so much more than me giving you the answers. But at the same time, I totally understand the time. It is a, it's a difficult thing. It's a commodity. It's a high commodity. Time, it's a high commodity. So I decided to take 3 days. It takes me 3 days to write rationale. It takes easily 30 hours just to write rationale for one task. So you guys have a idea of how much work that is. Anyways, all right. I know Terry had a question, but is it about, was you, Terry?
yes, sir. It was just what you was just saying. So
Oh,
your new, the question bank, right, where it says the 60%, that's where you updated the new exam.
no. So Terry, I believe was here from the diagnostic test 4. I am pretty sure was here. Let me log off as Joy and me. Let me log in as me again. And that way I can verify that for you. It has been a long 20 hours of work. Guys, do you see her screen? That means 137 hours that she spent on uh, on the question bank alone. So Joy put in a lot of work. When we say we track you, we really mean it. We know how much time you put in and what you did or did not do. Because if you don't do well, that's the first thing that I do is go back and track what went wrong, because you should pass the board if you do it, I wouldn't say the right way. If you find the master plan, okay, there is no right way. Your way is always the right way. I just try to provide some guidance based on 7,000 people in the last 6 years, right? So there is no right way. Is a way that I suggest to make it very clear. So now to answer your question, let me go here. Let me go to my settings, and then I'll answer that question for you.
Thank
So
you, Dr. Lopez, for answering my questions and for
yeah, my
helping me.
absolutely pleasure. So you are testing very soon, I suppose, because
Yes, sir.
yeah, because of if you are, because you completed everything. So yes, guys, so go where it says diagnostic test. So you see this, everything has an answer, right? If I go to any question and I go feedback, I wrote an answer to 30 hours of work just for you guys that asked for it. Okay. So if you can go to any question, it should absolutely have an answer. So if you're finding anything that's not congruent, always send me an email and tell me which question. I have over 2,000 questions all over the place. I can't really figure out if you say, I seen a question, and I'm like, please tell me where and be precise, okay? All right, let's get to the next person here. I am super sorry, but I am going to butcher your name. Yasi, Yasi,
I'm
Yumyasi.
Yasser.
All
Yes,
right.
it's just a nickname.
All right.
Hi,
Beautiful nickname. How can I help you?
yeah, my name is Hilal Omar. I just signed up the class today, actually,
Oh,
like
all
last night in
right.
the morning.
Oh my.
And I just joined so I can get a maybe some information here, but I haven't even done my diagnostic test, the pre-diagnostic test
All
yet.
right.
Mm,
Please ping me at the end of the class and I can do a little course run for you and for anybody else that is new, decided to join today, so I can orientate you to the course. It is not that complicated. Once you get the rhythm that you do a video and then you go to the question bank and you complete your question bank and you go back to the videos and you do the next question bank and you come to the live class as either your first pass through the content or a revision of what you already learned. But no worries. Thank you for being here, and I'll definitely give you a run through the course at the end. Let me answer these guys that are testing probably very soon. Okay?
thank you.
Please do not let me escape without giving you a tour. Okay?
All right, thanks.
Thank you. Lucille?
Yes, this is Lucille.
Lucille. Thank you, Lucille. How are you?
I'm good.
How can I help you? What are the questions that are running through your mind?
Just letting you know, I sent you an email. I did pass yesterday.
Mm. I've been working so hard that I try not to look at my emails as much, leaving that to my team. Well, how's your experience?
Um, I can't say anything negative. This program, I don't think if even as a FNP, when I did the pretest, I think I scored like a 68 or 69. And
Thank you
then
for saying
because I
that.
joined while I was still in school, so when I was done in May, that's when I really started studying for the boards. So while I was doing it in school, so I did the pretest again. So I got a 97. I'm like, oh, so I
Ooh.
did learn stuff.
So exactly, that is
Yeah,
exactly what we say. Don't look at your scores, even though I I'm weak. I gave you guys the scores. I mean, not the scores, the rationale, right?
yeah.
You don't want to look at the rationale
No,
because you want
because
to have a
when you
measurement.
do the pretest as a FNP, you're answering what you'll do, not what they're asking you. Because when you are practicing, you do what you want, not what what's on the book mostly. So you were
Yep.
answering it with the knowledge you already have, but not what they're asking you.
Yeah, and I wouldn't say a lot harder, but we have a lot of FMPs that do not pass the first time. We had Dr. Oh gosh, I forgot her name now. Last week, she failed the first time. She joined our course. She has 15 years of experience,
Yeah.
very smart, has a DNP, teaches in college, and didn't pass the first time.
You
I'm not
don't,
going to.
because as like
Yeah,
her, I had done over 10 years. I have my DNP, but it was like totally
perfect.
different. So I had to like take everything that I knew and start from scratch.
Yeah.
So
So, how long did you study for? Now, by
um
the way, before you answer that, I just want
mhm.
to clarify on what you said first because I think it's so important. Today, I answered an email and someone said, a student, I'm bummed out and depressed. I'm like, why? Because I scored 65 on my pre-diagnostic test. Guys, that is a good score. I'm telling you right now, the average is about 52, 53, 55 in the good days. Because it changes over the month, but we have an average is 55. We have people scoring as low as 30. And they really took 3.5 hours and they complete all 175 questions. So what I'm telling you is the pre-diagnostic test or any of our tests, they are hard. They're not necessarily a walk in a park, but we
I think
mold you.
it's harder than the boys.
Yeah, well, yeah, but the thing is that the board, it is equivalent. You're kind of
Yeah,
equivalent, but the amount of knowledge that you build over
yeah,
the
that's true.
8 weeks, it makes it the board feel easier because you work hard on the course, and that's why we drill you, give you a
Mhm.
lot of live classes, question bank, diagnostic tests to make it the test feel easy.
Yeah.
Now, if you don't do the right thing, If you
You
don't
don't. If you
study,
just do
you're
the
not-
diagnostic test, even though a lot of the question are from the diagnostic test, but there's a lot of question. It's not straightforward. You have to know the content. Like, it's not gonna ask you check the thyroid level. It'll give you a scenario, and then you have to find
exactly,
out what you're looking for. It's not gonna say check TSH. It's gonna be something else.
exactly.
Yeah,
Quick question: do you do the crash course review question bank?
I did all of them. Yes.
Did you find it very helpful or not
Very,
helpful?
very helpful. It's like repetition. It's like the same question going back and forth. And when you do the 4 diagnostic tests, some of them come back again. It's like repetition, repetition.
Exactly.
Yeah.
So, guys, that was the intent to prep you for the diagnostic test, because that way you see the question slightly different. You don't get
Yes.
totally
Even
thrown
with the
off.
Erickson, it's not some question. It's not just like, oh, pick identity versus role confusion. They'll give you a scenario
Right.
and you got to pick which one. And it's not even pick, which one of the tasks. You just have to know the content that it matched that one.
Yes, absolutely.
Yeah.
That is a very important feedback. Well, congratulations. So, what's next for you then?
Um, I'll take a little break, go on vacation.
Where are you going?
I'm going on a cruise tomorrow.
Oh,
That's why I wanted to take it before.
this is exactly what I did. I bought myself a cruise, and I said, if I pass, well, I'm going anyways.
I'm
But
going
at
anywhere.
least, at least
I'm
was
thinking if I
it's
don't
already my
pass,
present,
I'll
right? I
have a
already
drink.
know. So that is my present, and
And
I
just one last thing with the PICO, you asked, make sure you know what each letter stands for and then variation. So some of them may not be exactly what it stands for. So make sure you know different ways they say it.
Yeah, I mean, but I told you
Yeah.
guys you get a pickle question. I already
Yes.
told you this. I already said,
Yes.
hey, if you miss this question's on you, because I'm telling you ahead of time.
Yeah, because they try to trick you. They remove what we learn. They had the I. It was an intervention. They remove it, put it something else.
Yes,
So you
and
gotta
then
know.
think about this. You are tired. This is a question at
Mhm.
170. You're just not thinking straight. Your brain is losing glucose. You are hungry. You are thinking about, am I going to pass or not? And then you get a tricky question like that. You might just miss it unless if you drilled and you understand the content. Otherwise, you might miss it because they are going to make it tricky for those to discern those that know versus those that kind of know. You don't want to be
Probably
the
the only thing that wasn't on the test are the 25 question that didn't count.
yeah,
But everything you mentioned in the crash course was there. Everything
yeah,
that you mentioned, it
yeah.
was there.
And I don't say we start broad, but we go a little bit broader and we funnel into the crash course, and then we funnel really tight into the diagnostic test and crash course review. That is why, it is so important that you do the full course, so that way you don't get to see the diagnostic test. Once you see the question, there is no other way for us to know if you are going to pass. Be like Joy, took once, did really well, and nothing to worry about. You pass next time. Thank you, Lucille. I really appreciate the feedback. It's
All
always
right. Good luck, guys.
please send, you already sent me an email, so I'll
Yes.
definitely be answering if I didn't, but I will be answering. Well, congrats. You did
Thanks.
well. You rock. All right. Next person is Terry. Do you have a question there, my friend?
Yes, Doc. So
How can I help you?
So I did the crash course review questions. I roughly did it last week, and then I did the other test bank questions. So pretty much I have most of the test bank questions done. So I'm taking my I'm taking my exam on Monday. So I'm just going to do the 4 diagnostic tests now, right? One tomorrow, up to Saturday, so I can have the weekend to review it. Or should I push my test date back maybe a week?
So, Terry, I don't have an answer for you, because the only reason why you should push your test date is because if you don't do well in the diagnostic test, right? So everything comes down to the diagnostic test. That is, I would not dare to say this is the Bible, right? Nowhere near that. But to some extent, you know, if you woke up one day and you took the diagnostic test and you score like joy, hey man, then more power to you, right? But the reality is that we have to build you up, and we don't know if you are going to pass or not until you take the diagnostic test. So I don't have a clear answer to you. I don't mean to go around the bush. All the answers is related to the diagnostic test. It's like your final for your class. You did a bunch of homework, but the final is, you know, is what it counts, really counts, right? Everything else builds you up for the final. So to answer your question, I would, if you're off, this would be my strategy plan. I would go to where it says 4 diagnostic tests. I'll take diagnostic test 1 and see what you score. Do not despair if you don't score well. That should take you half a day because it's 175 questions plus rationale, right? You're going to read the rationale. So, and then have you revised the 4 documents that I've been asking everyone to revise them for the crash course review? Have you been looking at those constantly?
Yeah, I've been looking at those constantly. I made
Perfect.
flashcards. I've been, so I'm off this week just to make sure I study and get the diagnostic test done.
Perfect. That was my other question, if you are off or not. So I would take diagnostic test 1 tomorrow and then take diagnostic test 3. If you are scoring, you don't have to, you know, obviously you want to score as high as possible, but I wouldn't be too concerned if you score like a 77 and then another one you score 83, right? It's not a science that you have to have a 80. You know, why is the 80? Well, you need 70 to pass, and our diagnostic tests are very similar, I would suppose, to the real board. But you got to count for anxiety. You got to count that you may not have a good night of sleep. You got to count that you might be hungry. There are several components that we don't have control. So that's why we set the bar a little bit higher at 80%. So that way, if you blow the 80%, man, you can just tell your significant other, I'm just gonna go get this certificate, this hours, and go for it. Does that make sense? So
Yeah.
I would say take diagnostic test 1 tomorrow, is Thursday, and then diagnostic test 3 or 4, whatever you choose, because 1 and 2 are similar. 3 and 4, they are similar as well. So you want to have a variation, and then you go back to the other 2. If you are scoring somewhere, you know, around 70, around 80, it doesn't have to be 80, then proceed and keep as planned. If you feel that'll like, man, maybe I need a little bit more, you know, then you pull it back. Not to mention, you know, I had some people testing this week. They're absolutely in distress, and what can I say? The person's a rock star. I don't know if the person's here right now. She had nothing to worry about, but sometimes we have, you know, we are type A personality. I have to know all things, and because I'm not getting one thing on 2, don't let that disturb your peace. I told her, you know, you have a 97% probability of passing the first time, and I am pretty good at probabilities. Okay, math is my strong suit. So, you know, she's like, well, you know, then I'm going to keep my test. I'm like, hell yeah, you should keep your test. I don't have a crystal ball to say it's 100%, but I'm telling you right now, based on data, you will absolutely blow the test away.
Okay. All right. All right.
Yeah. Good luck, Terry. I wish you
Thank you.
absolutely the best.
Thank you, sir.
Okay. My pleasure.
Can
All
I
right.
give Terry a little advice?
Yes, please.
Hey,
Yes.
hello, everyone. Terry, did you say this Monday you were taking your test? Coming up? Can you hear me? Oh, maybe he's
maybe he's off on the,
Well, just for anyone. And when you rate
yes.
this close to take it, I actually got all the way to the fourth um, diagnostic test and the system went down. So you never know when the system's going to go down. And so you don't want to wait that close to take your diagnostic test because you have nothing to, you got your sheets, but that's not the same. And that fourth document, from what I heard, that fourth diagnostic test is very important that you really need to take 3 and 4.
Yeah. I mean, that is absolutely gold,
Mhm.
right? So
Yes.
I don't own a system. The system costs $500,000, right?
Oh, yeah.
So yeah, so I
Sorry.
rent them and it's outside my control. But just to cap on what she said, I was in so much distress because the system went down that I backed it up all over the place. And I went in 30 hours nonstop to build one test, to transfer one test, 30 hours, just to transfer, copy and paste into a new system and do the rationale. And that's why now I have in three different locations, because I have 3 different learning management systems. If something goes down, I'm able to mitigate, but it is absolutely important to still know exactly what she said. We have no control over the internet and how things can go down. And when you are taking a high stake exam, you don't want to leave this to the last minute, right? So great, absolutely great tip. I don't know if Terry is still around or not, or if he popped smoked. But anyways, let's keep on going. Thank you for the advice, as wise
Oh, you're welcome.
anyways. All right, Kimberly, are you there?
I am, doctor. How are you?
I am doing fantastic. How can I
Listen,
help
I,
you?
I got a question.
Sure.
So I've done the 4 diagnostic tests, but I'm only scoring 80 to 83%.
That is great. I
That
mean,
is good.
yeah,
Now,
now, Kimberly, I have to be very honest.
what?
Not to you necessarily your situation, because I don't know right from my, where you are, because I would have to look at in the system. Um, when you say I'm only scoring, just make sure that I understood well. The first time
First
you
time.
are, then you have nothing to worry about, because we have people that say, doctor, I'm scoring 90s, and I'm so nosy and I go check, and I'm like, you took the test 3 times, that doesn't count, guys.
Yeah.
I mean, it
No.
counts, but I'm telling you, if they switch one word, it's gonna mess you up, right? It's going to mess you up. So the true knowledge is the first time. So yeah, I don't think you have nothing to worry about. Make sure you are revising the 4 documents under the crash course review, right? That is like the 3 things everyone must do. I mean, I really mean you must do is revise the 4 documents under the crash course review at minimum 2 weeks before the board. Every
Okay.
day if all possible, right? And then complete your crash course review question bank, because I only questions that makes to the crash course review question bank are the most high yield. And I can almost guarantee you, just by doing those 7 days of crash course review that I have in there, right, for premium content, for you guys that are here today, I have a high high likelihood it will be on your test. It will not be word per word, because I don't write those tests and I do not have the test. But I've been doing this for a long time, over 6 years. So if I'm saying, guys, please do this, what is that? We're tripling down on what we think is going to be on the board. So it's reviewing your 4 documents. Where is your 4 documents? You go to all trainings, then you go module 6, just like you go to any document in the course. You go to module 6, then you select the first video of module 6, and then you are going to find your document, right? So the first step to pass the board with a high degree of certainty is to revise the 4 documents. Even though our crash course review is nearly 20 hours, 3 times as much as anybody else, to be honest with you, still it doesn't really cover what I really want to cover to make sure that you are 100% good to go. So then what we do crash course review day 1 and 2, and then I have a sheet here for medications, and I have one that I highlighted for you. I just took the time to highlight it for you. So that is the first step. What is the next step? Go into your question bank crash course review. Complete those. Do it early. You need to have some time management in a sense, but do them early because they are going to sneak up on you. It takes time. It's not like me writing the test, but it still is a significant amount of time. 65 questions should take you at least 2 hours to complete and read the rationale. So now imagine this. If you are trying to complete all the crash course review 7 days, that is 14 hours, a minimum, right? So you cannot leave this for the last minute, right? So even if you don't have it all things completed, start doing them early. So now the next step is, where is the crash course review question bank? I just kind of want to go over this because it's so important, right? If you don't see it, go here. There is a toggle or hourglass, whatever you want to call it. They're gone. Where is it? They're here. If you don't see it for whatever reason, scroll up and down. You have all types of questions here for you to practice. Where is my must complete after you complete module 1? So right here. Okay, scientific foundation, advanced practice, diagnosis and treatment, so on and so forth. This is the crash course review. So that is step number 2. Step number 3, complete your 4 diagnostic tests. So you guys really need to understand that this is time consuming. It's not a walk in a park, but it's here for you. If you do it, you will pass. Okay? If you do it, if you're testing tomorrow, you'll be like, oh my God, what can I do now? It's kind of very difficult to guide you. Another thing is, if you need some advice, start asking early, okay? Because sometimes I don't get through all my emails in a day. I never do, to be honest. But we are always working to always provide you more support, okay? The next, do you have any other question, Kimberly?
That's it, Doc. Thank you.
All right, thank you, Kimberly. Good luck on your test coming up, okay?
All right.
All right, Natasha, are you there? You're muted.
Right here. Hi,
Hi,
Dr.
Hi.
Everyone else.
Hello.
Hi. I think I need to be one of the people that's I'm very confused by all the different websites. And you went through the modules. I didn't see that on my account. I didn't see crash course review. I only went straight to the modules. I'm not sure if that's because of my program. I don't know.
So did you watch the welcome video when you first joined the program?
Yes, yeah, I did, but I didn't, honestly, I didn't watch the whole thing because I was like, I'll figure it out. And I can't.
Yeah.
I can't figure it out.
Yeah. So there is this video here, the welcome video is very important because it's going to show you where's the documents is located, where's the question bank is located, where is the diagnostic tests are located, how to get to them, what is your password, what is not. Now, I have a huge announcement, and I don't think it's going to benefit some of you guys here today. I just closed like extremely expensive deal. I had to sell a kidney for this. I really did. This is more expensive than 4 cars, brand new cars put together. So we're transitioning. I can't say the date because I have to rewrite a lot of questions, I have to create new videos and things like that. But in the future, in a very close future, you are going to have the same test experience as you would in the real test, where you are going to be testing like in a protomic environment. So you are able to see exactly how your test is. Not only that, we'll have the strongest analytics in American. Okay. Now, trust me, I only have one kidney right now, and this was almost divorce provoking. I drive a 2017 car, my wife a 2019, and she's like, "What?" I said, "You know what? I'm retired now, so I do what I want, I guess." And she smacked me. No, but just kidding. But this was extremely expensive. We broke a deal, still super expensive. But coming up, I mean, I'm telling you, this is so expensive that I lost 3 nights of sleep thinking, what was I thinking? Because our system is good, but exactly what you mentioned, going through different systems, my goal is to decrease your anxiety. If I can decrease it by 10%, 20%, just to have one system, one location, the strongest analytics of anybody. In fact, let me tell you a secret. It's the same system, ANA. They actually closed the deal the same day that I closed my deal with the same people. So they are going to transition their trainings to the same platform. It is a enterprise grade. I'm gonna have to work super hard to make up for this amount. But once it's done, if you guys are still here, if you guys are new students, you are going to see great things coming up in the next no longer than 2 months. I have to redo a few things in the course. We'll have flashcards in the course added. You have ability to say, hey, I'm testing 20 days. What can I do? Then the system is going to shrink and say, hey, this is how many nights you're going to have to be open. I am cloning myself in a studio with all my questions, all my books, all my PDFs. So you'll be able to ask any questions 24 hours a day. And if I have over five years of recordings. So if I ever said anything, you can just ask myself 24 hours a day. What else? I mean, it's so many things that, and no wonder it was extremely expensive, but it was a dream for me because this is what I do. I think I always want to do the best. So it's coming up. All right. Don't want to spoil it, but once it does, I will go ahead. And then go ahead if you have a quick question.
I have a couple more questions because you have this video up, right? I don't have that video. I have the video that I have is Success Guaranteed. That was the one I was looking at. I never saw this video, the one about PMH board prep orientation.
Oh, okay. So I did a orientation recently and I just uploaded to streamline it. It is the same content, but maybe a little bit better because I did a PowerPoint presentation for a university that their students all sign up with us. I kind of wanted to do it like a more formal, but it's the same thing. The content is exactly the same. It's just presented in a different way. Okay. But anyways, you can go back here to home and then you can watch the video. And then once you're done with that, you start your module 1, which is here. And then from here, you keep going down all the way to the last video. It won't show you to you like this, but once you go down to the last video, all you do is click, and now you see your question bank, right? So it's going to say, hey, here, click here to go to your question bank, and this is use your email address, use this genetic password. If you don't have it for whatever reason, always send me an email and they'll be able to help you out, okay? But I'll give you at the end of
thank you,
today's
Dr.
event.
Lopes. I have
Go ahead, please.
I had just one last question. I'm sorry.
No
With
problem.
Lucille Lucille had said,
Yes.
she had made a comment, something about the 25 questions that aren't tested. Do you know those 25 questions, or they're just
No,
randomly
no.
placed? Okay.
Great question, guys. Sometimes you might get these very, very weird questions first. Do not despair. You have been through the hoops with me. You have done a lot of questions. We have spent a lot of time together. You are very much likely to pass. So fight for every question. Do not put this in your mind. This is probably not a true question, so I'll just mark it whatever. We don't know what questions are the true score test questions. We don't know. Nobody does. Okay. So treat every question as if they are a real question. Every single one of them. They can be divided. They can come all the way to the end, all the way in the beginning. Great question. Okay. Because we have a lot of people say, Dr. Lopes, my first 25 questions, I knew nothing about it. And then after that was like all the way, got every single question right. So we don't know what questions they are. We have no idea. It's not reviewed. Okay. Alrighty.
Thank you, Dr. Lopez.
My pleasure. Thank you for being here. All right. Grace.
Hi,
Grace.
Dr. Lopez. Yes.
Hi there.
Hi.
How can I help
Good
you?
eve- Yes,
evening.
I have a quick question. Please, can you clarify a little bit between nicotine and Cymbalta? Does it affect Cymbalta? Because what
It does.
I know
It does.
smoking and tobacco.
Yes. So the question that I would like to ask you is why, if you know, if you don't, it's totally okay.
I think nicotine, if it's same as the smoking, is inducing.
Yes. Which CYP?
182.
Perfect. Excellent. So now I just want to use the correct terminology. You are absolutely right, but it's not smoking the nicotine, okay? It's the burning in the tobacco that is doing. It has nothing to do with the nicotine, okay? So it is the burning product. For example, even charcoal would be in the same category when there's burning. So, but you got the point. It comes with nicotine. I just want to clarify that because if you get a question, which I have never seen it, but probably would be a good question. Somebody's chewing nicotine gum. I'm sorry, and they are taking clozaril, duloxetine, olanzapine. How does it affect the medication? It doesn't at all. Okay, just want to make this clarification because this is a good tricky question, right? It doesn't. Does it make sense?
Yes, so it is smoking.
Yeah, the smoking product, the burning in it that
Mm.
causes induce. What else is in your mind, Grace?
Nothing.
Nothing.
That
Oh
will
my
be all.
God. Okay, that was an easy question. Thank you, Grace. All
Thank you.
right. Usu.
Yeah, Dr. Lopez, this is Linda. I'm using my brother's computer. That's why you see the name like that. This is Linda Mensah.
Hey, Linda, how are you?
I'm doing very good. Thank you for all you do.
Oh,
I'm
yes.
very glad to be part of you.
Oh,
I
thank you.
already know I'm on the road to success. I
Yes.
started about 2 weeks ago after
Okay.
wasting some time in a different place. I called you and then you were able to get me in. Now,
Yeah.
I'm on my 5th model. And what I'm seeing is I'm seeing
Oh.
a pattern that I have a very strong base in the model 1, 2, and 3. The psychotherapy and then the 5th one, I'm actually having a hard time grasping the concept.
All right. So I just want to clarify. So if you join in 2 weeks, how have you gone through 5 modules in 2 weeks? So, I mean, it's totally possible, okay? I just want to make sure that, because the pitfall here is that, let me give you a scenario, okay? We had a student that teaches BSN level. He's a professor. He teaches psychs. He took our course and just went through like this. Really went through like that. I know this, this is too easy. And he failed the board. And I called on him and said, like, hey man, what happened? You know, I said, Dr. Lopes, everything that you taught us was on the board. And I'm like, why didn't you pass? Because I just clicked and moved because it was too easy. I thought it was too easy. But when the questions came, I got all confused, and he teach psych. Just to give you a good perspective. Okay, it's in a BSN level, but still, if you teach psychs, you know your diagnosis, you know your treatment. I mean, you can't escape from that, even if it's the BSN level. If you are teaching, you should know this. But what I want to warn you is that, you know, it's totally possible. We have people that finish in 2 weeks, but they are working super, super hard to
That's what
finish.
exactly what I'm doing.
Okay.
I have about 4 hours in the morning.
Perfect. So
going through all the videos, maybe 2 hours in the evening. If I have to take a model test, do it. So I'm spending a lot, and I have decreased my number of hours that I'm working. I'm working only 10 hours, 3 days in a week. The 4 days I'm on it, and the other one I start work like 5 a.m. till 3:30. When I come, maybe 5 o'clock to 9, I'm working on it, even on the days that I work.
Perfect. So
I'm really working hard.
Okay.
Yes.
So can you tell me again one more time, you're having a hard time on module 4, therapies, and
module 5, like really
all right,
grasping it. I don't know if maybe I should do it repeatedly to get it.
All right.
Because those are not more familiar stuff with us, you know. Like,
yes. So when are you testing, if it's okay to say, like, roughly?
I haven't even got my authorization to test.
Oh, okay. All right.
Yes.
All right. So you're in a good place. So let's start.
So my goal is actually to do the test maybe somewhere 1st or 2nd week in August.
Perfect. So that's a great timing. So when do we do the live class? So let's start with most important modules, because that gives you a sense what you should really learn and not skip it. It's modules 1, 2, and 3. Why is that the most important? Because there will be 107 questions from domains 1, 2, and 3, which is our modules 1, 2, and 3. So if your problem is module 4, that is a great problem to have, because it will be only 17 questions from module 4. Okay. But now, generally speaking, module 4 is the hardest, which is a good thing. If it's the hardest and the least amount of questions, then it's a good combination, right, to have. So now, even though it's 17 questions, we don't want to throw them away. So let's clarify. If you go to your module 4 and you go where the first video is, that's where your PDF is located. After you have gone through the main PDF, which is located right here, you have a second one that I built for you on the go, right? So this is the main PDF, it's long, it's detailed, and this is the PDF on the go. Basically, what I'm saying here is, if I boil down each of the therapies in four words, what would I say about it? So I am making this, I'm going to be like a little bit more broad, not super broad, because we never go super broad. I'm going exactly to what matters. So if I click here and download this, let's take a quick, let's revise this in 2 minutes. So you kind of can see the level of, if you have gone through it, you should really be focusing on this document here, because it's going to say, okay, what is most important about module 4, therapies, right? So 1 second, let me Okay. Now is my computer's 1 second, folks. Let me shut some screen. Oops, I am showing my new test prep. So let me, well, I'm not showing yet because I've been working on the new stuff that's coming up 2 to 3 months from now. 1 second, please. Let me open this document, which is module 4. Everyone should really understand this document because it's going to help you pass the board. So 1 second, please. Let me kind of share my screen. So if I open this document, it's going to bring down to really allow you to, what is really important? How can I get the questions right? Even if I don't fully know module 4, right? So for example, if I go, can you guys see my screen yet?
Yeah.
Not yet, right?
Yes, I see.
Are you guys able to see it now?
Yes, it's there.
All right, so let me shut the camera here for a second for myself so that way I can talk about the documents. So I built you a PMHNP master table of therapies. So what is the master table? All right, let's start with cognitive therapy. What is really important about cognitive is only working with the mind, doing nothing else, is not changing the behavior. So what are the key focus? Changing irrational beliefs and cognitive distortion. All right, what techniques do we use? Cognitive rehearsal for real life situations. So basically, what I'm saying here is we are pre-training our brain for when it happens. So think of it as a fire drill. We do fire drill, fire drill, fire drill. If there is a fire, we know what to do. So one of the key techniques is called cognitive rehearsal. All right. So how about behavior therapy? We're not talking about the mind. We are doing something. We're changing the behavior. We are setting alarms. We are setting study time. We are, doing things to change the maladaptive behavior through active techniques. What kind of active techniques? This is so important. It will be on your board. Exposures, relaxation, skill training, problem solving. But you really don't need to memorize that as long as you understand behavior therapy is doing something about it. All right, when we marry both of them together, now we have cognitive and behavior therapy. So now we have changing the irrational belief and changing the doing, which is the behavior, right? And what are techniques are we going to be super high yield? It will be on your board. Journaling and cognitive restructuring. I guarantee you that's 2 questions on your board. All right, how about interpersonal therapy? Addressing interpersonal issues. What do I say to you guys every time? Do not pick couples therapy because it's a perfect question to go with couples therapy for a possible answer. And it's not about reconciling or falling in love again. It's about addressing interpersonal issues between the couple, right? So what is important about modifying interpersonal problem and managing relationships? So, and it goes on, psychotherapy or psychodynamics of Freud, right? Explore unconscious processes influencing our present. All right. How about psychoanalytics? The same thing. Unconscious mind influencing through childhood. So what is the difference between psychoanalytics and psychodynamics? Really? Nothing? Well, it is, right? Understanding psychoanalytics is just a little bit longer. It's going to go all the way back to childhood. All right. You know what? What's going to be on your board? Humanistic therapy is going to be on your board. Guarantee you that. Support self-directed growth and self-actualization. And remember, that is the same thing as person-centered therapy, which is also the same thing as Rogerian's therapy. What is the name we need to know about humanistic therapy? Who is known as the creator or the father?
Carl Rogers.
Carl Rogers, right? So Carl Rogers says only humans, for humanistic therapy, if you get the joke, can achieve self-growth and self-actualization. That will be on your board. I guarantee you this. You know what else? Logotherapy and existential therapy. You have to be able to differentiate. How are we going to differentiate them? Focus on the key words. Find a meaning in life, specifically through suffering. This is how you're going to differentiate, because they're like twin brothers. You can almost not differentiate them, but understanding those key words, it will help you. I give you a little table summary here, and then I just went on and built a little bit more comprehensive table. And I put who is the creator. Cognitive therapy, Dr. Aaron Beck. Behavior therapy, same thing, right? Aaron Beck. Cognitive and behavior therapy, the same thing, Aaron Beck. And then I give you 4 things that is most important about it. In case you want to not just know 2 things, you want to go 4 things, no problem. And here we go, right? And I built this for you, is in your course. Sometimes I even highlight, because I know this is going to be on your board, right? Self-actualization, self-growth, you know, existential therapy, logotherapy, trauma-focused therapy, MST, strategic, family, solution, structured therapy. You only need to know 3 things of each and you are done. You don't need to know more than that. Strategic, paradoxical directive, straightforward, reframing. Pretty much that is it. Solution, 3 things we need to know. Miracle question, exceptional question, scaling questions. Family system therapies, systemic therapy, genogram, self-differentiation will be on your board. I'm telling you right now, you should know. What is the goal of family system therapy? Self-differentiation and triangulation. So if you know 3 things about each one of them, you know, understand that the board is not in depth. They are not going to ask you super in-depth question. You need to know the basics, but know the basics well. And then structural, enactment, boundaries, genograms, and mapping. That's it. Dialectical behavior therapy, Marshall I am. What is the goal? You need to know what is the goal. Will be on your board. Diary keeping, right? It's something important. It's not part of the DSM-5, but it is super important. So what if you don't get it? That is fine. Print the PDF and every single day, ask yourself repeatedly. You are not going to get it the first time because there's a lot of therapies. Maybe you're not accustomed to see all of them. Maybe you didn't get those covered. But if every day you go back to the same PDF and tomorrow you don't get it, the next day you don't get it, the 3rd or 4th time that you are active recalling. What is active recalling? You say cognitive therapy. What is that? And then you kind of like spit it out and you look at it. I got it wrong. Tomorrow you do it again. It's a repetition game, right? That's why we have the flashcards. It's not part of the course, but you can get it if you want to, or you can build your own flashcards, whichever is best for you. It's all about repetition again and again. Hopefully that helps. Now, module 5 is tricky, yet the easiest too, because once we discern what is important and what is not, once we have a good understanding of laws in psychiatry, once we have a good understanding between scope of practice and standard of practice, once we have a good understanding, what else in module 5? Once we have a good understanding about what is important to the patient, right? What are the patient's rights? How consent is applied? How is confidentiality applied? Then that is it. You know, They are tricky. If you don't take a course like ours and you go take a test, you get all module 5 wrong because your school most likely did not cover laws in psychiatry. They did not, they may have said that Tarasoff principle, but they didn't say that it's not applicable to every state, right? By definition, it's warning the victim, but you are taking a national board. That answer has to be valid for all states, has to be the standard of care. Who creates the standard of care? ANA, right? So these are the things that are, once you go through in a course, you'll be like, oh, okay, now I kind of understand. And then when you see the questions, you'll be like laughing because you got it right. All right. So hopefully that helps a little bit. If not,
Yes.
do not super worry about it. Be on it. Try to understand. Do some research. Mark down what you don't. Once we cover them in 3 weeks from now, right? We're covering module 2 next week. Then you can ask as many questions as you like, and we'll clarify those questions. Okay.
Okay. Thank you.
Good job on covering the modules kind of fast, and now you come to the life. It's, that's what guys focus. Focus on the work. Don't be on the course for 3 months because we don't charge. Do it in 8 to 10 weeks. Focus, because you don't want to just be in a class for being in a class, then forgetting what you learned before. All right, Tega.
Hi, Dr. Lopez. Thank
Hey.
you. So my question is, I don't know if you already answered this because I was in and
No
out, but
problem.
the 600 questions, what are those?
So, Tega, are you in the main course or crash course review?
The main course.
Okay, so I can cover that again. That's not a problem. So the 600 questions really is a misnomer, right? Because I can't stand anybody, whether they paid or not, to see them not passing the board. I just can't. It's by on me, right? So I gave it for free for the people that did the crash course review. They didn't buy it. It's not theirs, but I cannot give it the same type of question that I gave it to you because it would not be fair. So I created another 600 questions. Now you are in the main course. You can get the 600 questions that I released them on the crash course review week, but time is a difficult thing, right? So this is, you will see my back end of my system, so don't mind that, okay? So basically that is the crash course review here, that what you are seeing right now, right here in the end, okay? So if you go to the main course, if I go to preview, now I change my screen so you can see it. So you can go to the crash course review. Is a little bit different. It's not 600, it's 500 questions or so, 7 times 65, to be honest. But more questions will be coming up, right? So these are the questions that I'm referring to. Now, remember, if you don't find it, you have to click the arrow and it kind of goes down and up, and then you see it and you don't, right? Okay, so this is towards the end of your prep. Does that make sense?
Yeah, so the 600 questions are basically the crash course. It's not an extra.
I don't want to mix it. The 600 questions that you are seeing right here is your powerhouse, right? The only questions that makes to here is what I have a high confidence that you will likely see on your board. Like, you can pick any questions here, you will see on your board one way or another, right? If I pick whatever question here, just pick a module, for example, no doubts you will see this question on your board. Someone with ADHD, he is oh, I said 65, and stating, I am forgetful. During the interview, she tearfully shares, I can't remember, I was at my daughter's wedding just last week. She reports this level of forgetfulness is new. That is the key word. Can ADHD be a new thing? No, it can't. Why? Because it has to be presented before age of 12. So even though you may not entirely see it, that is the prompt. If it's new, it cannot be ADHD, right? So what do you do, right? You can do a mini cog. So for this question here, you do a mini cog. But there is other question that's related to this, is that in this case, you would not call it ADHD, you would assess for something else. That was a second question that connects to this one. But what do you do for someone that is forgetful to the beginning? So you do the mini cog examination. Let me see if I got it right. And then I'll give you like a full rationale. I got it right. Lucky.
Yeah.
Yes. All right. So why you do mini cog? Because it's like the cage. When you do the cage and you identify the score is 2+, you go for audit or cage aid, you go to dust. So the mini cog is like your mini assessment for the MMSE, slum, or other tests that we have, right? So you do a mini cog. If it's positive, you go on to something else. So all these questions are very high yield, so I would not skip them at all. Just saying. Okay. Did I answer your question there?
Yes, sir. Thank you so much.
My pleasure. Pearly, hi there. Are you there?
Yes, I'm here, Dr. Lopez.
Hi.
Hello.
Good evening. How can I help you?
Good evening. Do you recommend? So I've done all the modules, but I wasn't doing the QBank. So I went back and redid them. So for module 1, I finished that. I finished the QBank. Now I have written some rationals that I'm reading every day. Do you recommend to go back and redo the test, the QBank, to see where am I?
So when are you testing?
I'm not testing until the end of the month.
Oh yeah, go ahead. I mean, the more the merrier. Why I clench my teeth, right? Is because if you learned the material and you didn't practice, you forgot.
I know. I
You
wasted
forgot.
that time. Yes, I
Yes,
wasted.
you know, you didn't totally waste it, but the knowledge you have to learn, apply it, because that's when you're
Yes.
going to see the pitfalls. Like, oh, I knew it. I thought I knew it, but I really don't. These are the gray areas. But yes, go ahead. What I would say is get your PDF, active recall. Don't read it. Look at the topic and say, what do I remember about lithium? Even if you don't remember a whole lot, and then you read it. Don't just read it. Force your brain to speak it, to say it, or whatever. And, you know, even if it's not in the PDF, but there's something that your brain says about lithium, you know, and then you do all those 23 topics that we have for module 1, and then you do the question bank on module 1. And now you have closed one module. And then active recall is fast. You don't have to go back to the videos, right? You have gone once. You want to retrieve your information. By the way, memory is what part of the brain as far as the limbic system? What would you say about that?
Hippocampus.
Hippocampus. Yes, hippocampus, right? So in order to consolidate your short-term to long-term memory, you need sleep in the hippocampus. Yeah. So since we were talking about that, let's talk about a high yield question. Where the circadian rhythm in the brain for sleep and awakening cycles?
Hypothalamus.
Hypothalamus. Okay. What is inside of the hypothalamus if that is not your answer?
SCN.
Yes. S, which stands for supercharismatic nucleus, right? So when you are answering questions about circadian rhythm, remember two possible answers. Why two possible answers? Because it really is one. Because the supercharismatic nucleus is inside of the hypothalamus. That is a super high-yield question. That's why I want to talk about it. Not to talk too much, but I can't stand. I can't help it. That is the truth, right? If I talk about something, I gotta give you something that's valuable. I just can't. All right. Did I answer your question, Pearly?
Yes, yes, Dr. Lopez.
Yeah.
Yes.
I think you
So-
have time in your hand. I think you need to start plotting what you need to do. Maybe the first 2 weeks you conquer modules 1 through 5, active recall in the question bank again. So that way you're super fresh. The next week and the third week, conquer all the crash course review. And then on the fourth week, early in the fourth week, you finish all your
Do the
diagnostic
diagnostic.
tests. Now,
Yeah.
you have a huge advantage, because the crash course review is the end of the month. So if you are testing right after the crash course review, which I absolutely hope that's what you did, then
Yeah.
you are in a good place.
Yeah, I have a calendar. I have our calendar in my wall, and I look at that.
All right. Yeah. So that
that's
is
the
very
plan.
strategic. Think about this. We spend 20 hours on the most high yield content and you test immediately after. If I open my emails, you'll see immediately after the students pass. And then it kind of stabilize to few students a day. And then crash course review comes up again as passing. Do it if you have a chance. But like even today, we have like 7 people that passed the board, and we have, had the crash course review 2 weeks ago. But it's a lot better to do it right after the crash course review. Okay. The crash
Thank
course
you.
review. So yes. So thank you, Mallory. Everything is great question there. She did not realize the crash course review was live. Everything is recorded and available in your modules. Why do I do this? Well, let's say I don't have the crash course review until the end of the month, but you are testing in the middle of the month. You shouldn't be out of luck. Now, please, guys, do not, let me mute you here, Scholar, for a second, just for better mic. Please, so sorry. Please, Scholar, I think your mic, I have to mute you here because there's interference, and then you can unmute yourself kindly, please. Let's say you work during the crash course review. I still want to give you the opportunity to review it, right? Now, that's what I want to say. Do not watch the video for the crash course review if you are coming to the live class. It's not a waste of time, but if you are coming to the live class, then that module, after that you have your PDF. So I would prefer, I think would be a wise decision, not for you to spend 20 hours watching, then you watch me live, and then, spend those times doing questions. That's what I'm trying to say. But it is there for you. If you feel you want to watch the videos now, you can. This why is there, right? But we'll cover the similar content on the crash course review live. Okay. All right. Let me go to the next person, Mrs. M. Doe. Mrs. Doe, you are
Yeah.
muted. Yes, go ahead, please.
Yes, Dr. Lopez, I have a
Hi.
question. I think I'm a
Sure.
little bit behind since I joined you the end of June. Yeah. For module 1, 2, and 3, do you have them pre-recorded for me to watch the module?
Yes, everything is pre-recorded and available. All you have to do is go through your course, scroll down, and then you see the next video available. If you watch the video, it disappears. Where does it go? You go to all trainings, and then you are able to see all the trainings in your course.
Okay.
Right? So if you go, for example, here, and you watch this video, so the idea is that I don't overwhelm you. If I show you 27 videos on module 4, you'll be like, oh my God, even though there are 10 minutes videos, they are not that long, but I don't want to overwhelm you. So I show you one thing at a time. So once you see this video, you go down, you mark somebody said, Dr. Lopes, the system is not tracking me. Well, in order for it to track you, you have to click here. So that way I know where you are, right? I know exactly where you are and what you're doing. If you're going through the videos, this is module 4. Let's say you go here and then you just, once you're done with the video, you go to the next video, and then what's the next videos will be below that. Now, if you say, oh, I want to watch the dopamine pathway again, you go to all trainings here.
Okay.
Then you click module 1. Let's say click module 1, and then all the trainings for module 1 will show up for you, like the dopamine pathway and so forth, right?
Okay.
So, yes, and I would say, I don't know if you did or not, but take the time to watch the welcome video, because it's going to kind of like really put things together as much as possible, at least, to, so that way you know your password, you know where to go and so forth. All right, somebody said the volume for those short videos are not audible at all. Great question.
Low. Very low.
Okay. Great question. So let's see this video, for example.
They are good. They are audible.
Yes, they are. But let's see why somebody said that. All right. All right. So thank you for being here today. And hopefully this will provide a very good. So let's say I can't. This is not a good one. I want to show you something different. So let's go the first video on module 1. Why somebody said that? It is a great question. It is true from her own perspective, right? Let's say I don't hear anything. What do you see here? You have a toggle in the video.
It's very low.
Then yeah, you can go 0, as you can go high. So that is one thing to keep in mind, right?
For your upcoming board certification.
So make sure that in your video, this is all the way up.
Devote
okay, and then that way you should be able to see it. So here, if I go to my own volume, which is low, I can hear perfectly well. Okay, so make sure your computer, make sure, like I have the lowest volume here for me, right? If I go high volume, I can hear even more. So make sure that on the video, you have the volume set properly. Okay, so that should be able to help you. Now, like me, I have my volume here. I need to set my volume high too, right? So these things are to take in consideration. Okay.
Here we are. This is our roadmap. On our first train.
All right. So hopefully that helps. If it doesn't, sometimes it might be things like clearing the cookies or log back out. But just remember, there's a toggle here in the video. You should be able to hear that. Okay. All right. Next person, Minerva.
Yeah. Hi, good night, Dr. Lopez. How you
Hello.
doing?
Good. How can I help you?
So I joined the program, like I think I'm going into 3 weeks now. I just completed module 3, you know.
Perfect.
I did my test and stuff. So I will be testing to the end of the month. And after the crash course, which I was so happy to see, Because I think I scheduled my time before I seen that schedule. But you
Yeah.
said it started at 10 in the morning, and what time approximately will be ending?
Usually class ends about 6 p.m. and then I will
Oh, from 10
stay.
to 6. Okay.
Yeah, but then I will stay
Okay.
until 9, 10 o'clock until all your questions are answered.
Okay.
So
Awesome.
usually it would turn into a 12 hours class,
So
but
that's
the
awesome.
lectures would be anywhere between 9 to 10 hours each day.
Mhm.
And then I will
Mhm.
stay back for any questions. Okay.
Okay. Okay. Cool.
Thank
That's it.
you.
That's all my question. Thank you so much.
All right.
Mhm.
Yukimi? Yukimi?
Yeah, hi, Dr. Lopez. This is Yakeem here.
Hey there. How can I
Hi.
help you?
Yeah, I do have a question. When do you think it's advisable we run through the whole diagnostics before our board exam? Is it within the week before the board exam or 2 weeks prior to really,
Look,
boost our
my
chances of making it?
I don't think there is a science to it, but you want to know. This is what I think, and I don't think it's true for everybody. Let's say my board is on the 30th. In my mind, I want to say my board is on the 15th. So that way I can have everything done and wrapped up at least 2 weeks before the true board. So I would have completed everything 2 weeks before, and after that I would revise things, adjust things, do things my way. Why doing this way? Because now, let's say you prepare, and you find out that you are not there yet. So at least you have 2 weeks. You don't want to find out where you are 3 days, 4 days before the board, ideally.
Right.
Because that doesn't give you enough time to adjust if you need to. You can
Yeah.
do a midnight, burn the midnight oil, but it doesn't give you a whole lot. So if you have the opportunity to plan it out, try to close everything within 10 days. You can always redo the diagnostic test, but when you do it in such a way that you are evaluating your true knowledge, not just completing. Because the idea is that you take a diagnostic test and you pause and adjust like you would for the real test. You wouldn't take a test today and walk that tomorrow and take another one, right? You
Right.
would look it up stuff. So that 2 weeks is exactly for that, to kind of allow you to, few days, go look at things that you missed, go look at the topics, and then you take another diagnostic test. So the idea is that you don't take one back to back to back. Now, how many people do that? I really don't know. But I can show you 7,000 scores right in front of you right now, because that's how many people have taken those tests. And this is super high yield. This is what I would suggest. I don't think there is a right or wrong answer to this, but it's a possible suggestion. Does that make sense?
Yeah, makes perfect sense.
Is anything else in your mind? Anything that I can do for you?
Nothing else. That's it for now.
All right. Thank you for the question. India. India?
Hi, Dr. Lopez.
Hi.
Hello, class. So is this the same question? So, Dr. Lopez, if I don't know why it doesn't look like I'm progressing, but I started really getting into the courses like in May. And so I feel like I gave myself at least 8 weeks. Now I'm down to like my week 4. And it's like how you said, it's just like catching up on me because I have my testing date is on the 30th of July. And so
Yeah.
I don't know how I'm only at module 2 right now, but I went backwards. I went to module 4 because it's so big. And on a diagnostic test, I noticed that I really didn't do well with therapies. And it's really like personally my hardship. Like
Yeah.
it's just a one and then the Erickson's is just something that I just find difficult or just a lot. And so
It is.
I went backwards. I went from 4. I think I even did 3, but I think I for sure at 100% did 4. And now I did 1. I completed 1. I took the diagnostic test and say, I was trying to find out, not diagnostic, I'm so sorry. I took the
Question bank.
question bank, and I think question bank 1 has 115 questions. I can't remember. It's 160 questions.
Yes, 161 or 165, correct.
So like I think in that one I got like 101 right, and I was so distraught. Like I was because I mean Dr.
No,
Lopez, I
no.
really studied for like module one.
So
I feel like I studied my butt off.
it's not your fault. It's my fault, right? Why do I say this? It's because some of the questions, it doesn't really reflect your true knowledge. Okay, so don't despair.
Yeah.
Some of the questions are mixed, right? You might have like 20 or 30 questions. I would say 20. That doesn't really belong to module one, for example. So what is really important is that you learn from it. And sometimes we learn more when we don't do well and we read the rationale.
Yeah.
Because it's impossible to say, let's talk about diagnosis and not, let's say module two, right? Advanced practice skills. Then we have CIWA. Well, obviously we have to mix with some of the module fours, motivational therapy, right? So it's kind of like some of the questions may drift, but as long as you understand the question and you learn from it, it is all what matters. You don't have to get 80% in the question bank.
Yeah. So I
You
think I
need
was
to
like
learn from it.
70 something,
That
but
is perfect. That is
I
okay.
think I because I had to like do it like I had to Google it. I was like, how much is one? I think I was at 101 or 115. I can't remember how many questions I got right. I think maybe 115 or 101, but I think it was 115. And I think it came to like 70 something. I was in the 70. And so I felt the same way I felt when I did the first diagnostic. So I have three questions basically. The first diagnostic, I'm 4 weeks out. I only did the first diagnostic test. And so when do you go to the second diagnosis? Because I heard from
At the
tonight
end,
at the end. So
yes.
I heard that diagnostic 3 and 4 are the most important, or is it 2 and 3 that are the most important?
They're all important. Why people say 3 and 4? Because these are the last ones they take. So that these are the last ones they remember. So remember, each of those tests are 175 questions, just about. I know one
So
is
when do
not.
you take like the diagnostic test? Is like because my whole thing is I have 4 weeks to go into my exam
Yeah.
today.
So what I would suggest to you is go hard as much as possible, and then start planning to take your diagnostic test just before the crash course review. And
So
then you
like
finish
a week before, because the crash course I think is on the 27th.
26,
The
25th, 20,
26th.
25th, 26th, I
25th,
believe.
26th. Yeah.
So, whatever that weekend is. But go and try to have things wrapped up by then, and you just finish it off with a crash course review, and then after that you only revise and think for your test.
I'm hoping to God because I don't know. I I'm trying my best. Like I'm really trying my best. But
I know.
I wanted to. So that was one of the first questions. The second one was that like today I had to work. So when I work, I tend not to listen to your videos because I'm not absorbing because I'm focused because
Yes.
I work in the ER, the psych ER,
Oh yeah.
and so
Mhm.
it was a crazy day. So we're giving IMs, people fighting us. It was just a mess. And so what I do is I do the questions. So my second
Perfect.
question is I went to the supplemental and
Questions.
I went to module 1 just because I wanted to make sure I was strong before I walked out. Even though
Mm,
I'm already in module two's videos, I
right.
was probably like in video 5 or 6 in module 2. But I was like, I'm gonna do a supplemental of module 1 just to make sure like I really know this. And I don't know why, and maybe other people can comment on this. I just love the rationales in the supplemental. I just love how they're like high yield and like, they give you these little like acronyms and these little things to like remember. I feel like I can understand the rationales in the supplemental test better. I don't know why. I just love it. I have like four big old papers of like notes just from the rationale, just writing them down to reiterate because I just love them.
So
I love the
yeah,
rationale in the supplemental.
because every rationale I try to connect to another question, even
Yeah.
though I give you a little bit more than the rationale to help you get more out of the rationale. So I try to implement that. But
Yeah.
wrapping it up, I think you are in a good place, India. I think
Yeah.
you are smart. You are capable. just keep pushing. I mean, keep pushing, and then at the end, everything comes together. It is
Yeah.
what everybody goes through it. You know, they start like, oh yeah, I'm gonna crush it. And they were like, oh my, I am in trouble. And then it goes like, yes, I totally crushed it. So it's an expected learning curve.
Yeah.
So, okay.
I guess I'm just worried about my time frame. I'm like, am I on track? Because
You are on track.
I'm at module 2, but technically I already did module 4. So
Right.
I've
So
done
remember, we're still gonna cover 2, 3, and 4 and crash course review this month. So you're
yes.
in a good place. So you
Okay.
shouldn't be too worried about
My
it.
goal is to make sure I have hopefully 2 and 3 done by the time we do our live, which I
Right.
think is on July 7th. When you
Mm-hmm.
go over, I think it's module 2 we'll be going over. So I did it for the last one, and when you went over module 1, I knew everything. Like I didn't know how to
Perfect.
answer the questions, but I know it felt all familiar to me.
Yeah, so that the
Yeah.
idea is that if you have gone through the videos once, or if you have gone through the live once, when you watch the video, it makes sense. Sometimes it takes us reading a different material or hearing somebody else in a different perspective, and even though it might be the same content, it's never the same because I just don't use notes. I never used notes in my entire life. I speak whatever comes to mind. So every class, every recording is the same, but it's different.
I also have a quick not a
Sure.
question, but kind of a question. Do you do you frown upon what I've been doing also is when I have my phone handy, and this is an idea for you, Dr. Lopez, to do. I use pocket
Prep.
yeah, pocket prep, just because it's like right at my hands, and
Yeah.
I'll go and just start answering questions. And so what I've been doing is there's something called level up. So it's like 15 domains and maybe module 1 specific for like advanced practice or for therapies. And I'm like, I want to master all 15 of these things. And so I'll just answer like, in a day, I'm probably answering like 100 questions, but I don't want to confuse myself. So do you frown upon that? I was like, I
No,
hope he's
no,
open,
no.
like gives his own app where he
Yeah,
has questions too.
yeah, it will be. It will be like in probably 45 days or 60 days. So
Got you. Got
but
you.
why it is a good thing. Okay, it's not a bad thing. Now, what a lot of people would do is teach you so broadly that may not be very helpful. So if you are crunchy for time, um, instead of doing those, I would suggest you do our stuff, because if it's in the course, it will be in your board. While other stuff might be a good technology or way better technology, there is nothing wrong with Pocket Prep. It's wonderful, but it is broad. So the question is not going to be high yield as what we have here. Now they have way better technology for now, at least. But yes, I would say so for sure.
Okay,
I
thank
don't
you so
frown
much.
upon. Yeah, I don't frown upon. I think it's useful. I think it's helpful. But if you are crunchy for time, go for what you know that's going to be helpful in the board. Okay. Alrighty. Thank you.
Thank you.
All right. Natasha. Natasha Rivera.
Hi, guys. Hi. I'm right here. Hello.
Hi.
It takes me a couple of seconds. I was going through the I'm trying to find this page again where it has the modules, because I printed all the
Okay.
modules out. I printed
No
everything
problem.
out. So I
No
found
problem.
that page. Okay. But now I can't find it again.
All right. No problem. So it doesn't matter where you are in the course, you always have a home button, right? So let's say I'm here and I don't know where I'm at. Just go to home. You go to home over here on the left-hand side. Do you see it?
Yes.
If you go here, now your next video will show up here below.
Right.
Okay. Oh, I don't want to watch this video. No problem. Go to all trainings. Now you can select any of the trainings for your course, modules 1 through 6. Oh, I want the PDF for module 4 or 3. Let's say 3. It's always above the first video of each module. So let's say I'll go to module 3. Click on the first video, what is tolerance? And now you have your PDF right here on top. So your PDFs for all the course is above the first video of each module. So go to home, to all trainings, find the module that you want the PDF, and click on the first video. Does it make sense?
It makes sense, but I still can't get out of my 30-day, whatever that is. It says AC or psych, but like the
Okay.
first page that's blue. And then I'm
So
looking, yeah.
1 second. At the end, if you allow me, I will click on your page as you, if it's okay with you, and then I'll just show you, okay? Let me get, folks, let me get questions, like questions about the board. Give me some hard questions, something that is in your mind. And then after that, I'll go through the course and then kind of like walk you through anything. What is in your mind? What is making you lose sleep? What kind of questions you have? Not the course, but questions about content. Anybody? Kareem, are you there?
My issue
Actually, let
is
me,
the
Cynthia,
CIWA and the cow scores.
perfect. I can go over there, but let me allow Kareem first because she has her hand up, and then I can go CIWA and cows.
Hi,
Kareem,
thank you.
hi there.
Can you hear me? Hi.
Yes, I
I
can.
actually am losing sleep about the cranial nerves.
Ooh,
I don't know
okay.
why. Is
Yeah.
that something that we're going to be seeing on the test?
One question to 2 questions. So what do you need to know? Cranial nerves 1, 5, 7, 9, 11, and 12. So, I mean, I narrowed down to 50%, right? And it doesn't mean that 2, 3, 4, 8 will not, 6 will not be there. But I'm saying, hey, if you want to narrow it down, go to 1. Sometimes people lose sense of smell. Go to 5, mastigation. Go to 7, facial nerves. And then you have 9, 11, and 12. Right, 12 is to assess it for TD, and you use AIMS. So it is something you will see it, I'll tell you why. Because it's content that you saw in your BSN is the content that you saw again on your master or doctor's level. So if you want to know what is going to be on the board, one easiest way to figure it out, I'm going to tell you right now, ask yourself, did I see this content on my BSN? Yes. Did I see it on my master's or doctor's? Yes, will be on your board. So let's go through. Cranial nerves, PICO. You saw that on your BSN. You saw that on your master. These things that are like nurse related that you saw in your BSN and you saw it again, it will be on your board. That is like the easiest hanging fruit, I'm telling you right now. Yes, it will be on your board. Now, don't expect to be 5 questions on it, right? You might see 1 or 2, I would say.
Okay, thank you. And then also, I took a diagnostic test, the first one, and scored a 91 yesterday. The second one today and scored an 85. I'm scheduled to take the board tomorrow.
Shit. I'm sorry.
My question is, do you think that I should do diagnostic 4 or 3 or 4 today?
I can't really tell you that, but I think
or just leave it.
No, go do it.
Do it. Okay.
Go right now because you don't want to lose sleep all night, but go do it. Take 3 or 4 and go do it. Listen, you will pass. Okay, Karen, it's a very strong score for diagnostic test 1 and 2. What I wish you had done is take 1 and 3 or 2 and 4 because 1 and 2 are similar. But go ahead, go take your test. See you later. Okay, and email me tomorrow when you pass the board.
Okay, thank you.
All right, thank you.
All
Bye.
right.
Grace. Hey, Grace. Grace.
Hi, Dr. Lopez.
Hi, do you have a question?
My question is, do they have select all that apply or
No.
diagram something?
No.
No.
I mean, it was on the works, but it was never materialized into a test. It was a part of the planning in the past, but no, they do not. Okay. All right. So did I answer your question there, Grace? Good.
Yes, please.
All right. So Cynthia, you asked about cows and CIWA. What is specifically about it that you kind of want to
Just the way
clarify?
to calculate it. How do you calculate the scores?
All right. So let me ask you a question. Why do we do CIWA or cows?
To assess
Don't
alcohol
tell me that,
use
please.
disorder.
Don't. No, that is a trap. You get it wrong.
Okay.
Okay. So no, it's what people think. What is the answer?
To screen.
No, I don't need it.
To guide
CIWA
the treatment.
guide the treatment. That is
Okay.
very important, everybody, and that is a super tricky question, right? Because instinctively we think we do it to assess for withdrawal. Do I really need a scale to see if somebody's going through withdrawal? No. Why do I need cows and CIWA is to drive my treatment? Yes, and also to assess. But the reason why we do is to drive our assessment. Why am I saying this? Because this is a board question, possibly. Okay. So the first thing is to know why we do it. Yes, everybody knows because of withdrawal, but the true reason is to drive, the number one reason to drive our treatment. Now, you have to always remember what cows is standing for and what CIWA is standing for. So that's the second thing. The third thing is, can you, Cynthia, if you don't know it, that's totally fine. Somebody else can help me out. What is, start with CIWA. When do you start treatment?
When it's 7, you do PRN. When it's 13, you do PRN and schedule. Over 13, 15.
I have it when it's
You
8,
start at 8.
8 and
When it's
above, you do
8.
PRN,
On
and
the
15, you do PRN and
You
schedule.
PRN, yeah.
Okay. So another clarification. You are definitely right, Minerva. But I
Minerva.
want, yeah, Minerva. I want to clarify that if you have a question, that's very important, everyone. If you have a question and you are able to cross it off 3 of them and says CIWA starts at 7, is not wrong. Standard 8, but 7 is totally acceptable. Okay, so the first point is 8. If you start at 7, it's not a big deal. It's not a wrong answer. Everybody understand that, right? Because the standard is 8, but a lot of hospital in practice do 7. Okay, so that is very, very important point. I have a question like that, and that kind of tricks everybody. Now, starts at 8 or 7, 8 usually, PRN only. Then when the score is 15, now I'm going to do the PRN plus schedule. So if somebody has a liver disease, then we're going to do love, right? Lorazepam. Love is my liver. Love is my liver. Because it's fast, as you need to know the why, the in and out, the half-life is fast, right? So it does what it needs to do, takes the withdrawal away, and it's out and doesn't really metabolize through the liver. Now, cows, Cynthia, since she asked the question, and if she doesn't know, anybody else can help. What is the score that it starts with cows?
9.
Cows? No.
5.
Sorry,
Give
sorry,
clonidine.
5.
5.
Then we
okay.
give clonidine. When they hit blink, 13, then we can
13.
switch to Suboxone
Suboxone
or
or
buprenorphine. Okay. So now to answer your question, how do you calculate CIWA? It is a very unfair question. And there is no way that anybody, I wouldn't say anybody, right? That would be kind of bad. But
7 points for each.
yeah. So what I would recommend for you is to look at the CIWA score model and kind of understand what a 7 looks like, because some of the 7 doesn't seem to be that that much of a problem. So let's quickly look at it. This is not a class, as I promised it wouldn't be. But if I open quickly CIWA, right? What do I see? Let's see, share. If I open very quickly here, I see my guys. Can you guys see it?
Not yet.
Not yet. Okay, so it's coming up very soon. All right, 1 second, please. All right, it's starting in a second. So if I open, sorry, if I open CIWA, all right, so look at 7, constant nausea. That does not seem to be a 7, right? So what I'm trying to tell you is that you need to look at CIWA and understand what a 7 looks like. Tremors, even when the arms are not extended. If I'm like this and I have tremors, that is a 7. That does not seem like a 7. Some of the things do seem like a 7. Drenching sweats. Yeah, that seems like a 7. But anxiety, this one definitely seems like a 7. Delirium, right? Acute panic, got it. Pacing back and forth, that does not seem like a 7. What I'm trying to say is, look at what a 7 looks like, and then look at what a 4 look like. A 4, it's always modern. Modern headache, modern anxiety, modern agitation. Now, you can beat the test by using strategies, right? Just by looking at it. They are not going to ask you what's a 2, what's a 6. It's pretty much a 4 or a 7. Now, the last thing I want to say is, how many boxes do we have? We have, right, 10 boxes. All of them are 7 except orientation. Where's my orientation? Did I skip? Orientation is 4. Here we go. 4. So now the most you can get, even if everything is a 7 and one is a 4, is 67, 67, 67. So if you get a score of 68 on your test, please don't pick that, no matter what you do, right? Because it can only go as up to 67. Now, do not lose sleep over this, because at the end of the day, it's one question. One question, right? So it's good that we get one question, but it is not the focus that you should be like spending a couple hours learning that. It will be on your board, I'm telling you right now, but you shouldn't be spending all your time and energy for one question. So you will need to spend your time and energy for things that will be like several questions: dopamine pathways, medications, diagnosis, advanced practice skills. Okay. All right. Let's go with Shiveli.
Hi, doctor. It's Chevelle.
Chevelle, thank you.
Hi. So I have just started reading on module 5, ethics.
Sure.
And as I was going through one of your questions here, and let me just read it. In a recent outpatient consultation, a psych NP, a patient displayed aggressive behavior towards his boss during a heated argument that escalated into physical violence. The patient later expressed an intention to cause harm to his boss upon returning to work. So the question is asking, what would be your appropriate answer as the psych NP in this case? And the correct answer was to consult your state board of nursing to assess the potential risk. But
what is the other options?
The other options state A, reach out to the patient's employer to address the potential for dangerous behavior.
Okay.
B, ensure that the patient agrees to a no harm agreement. And I know you said no for that one. And C, firmly discourage the patient from contacting his boss. D, consult your state board of nursing to assess potential risk.
All right. So why it is the best answer? What can you tell me about it?
Because the duty to warm is not there.
Well, yeah. Well, let's rephrase it. Let me see from Chevelle. Chevelle, why do you think that would be a better answer, or that is the best answer in your mind?
Well, I don't know because at first I was thinking
Okay.
about the line of
So
duty born.
okay. So let's think about this. Is the Tarasoff principle applicable in every state? Yes or no?
No.
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 Right. All right. Who defines the scope of practice?
State board.
Board
The
of
state,
Nursing.
right? So if the answer has to be unanimous among the 50 states, right? It cannot be what you would do in California. It has to be done in every state. And if we know that it is not applicable in every state, where would you go to consult about your scope of practice?
The state board.
So that is your answer. It is a lame answer. It's a ridiculous
I think
answer, right? It is. But think of this way: you are following the scope of practice within your state if you don't know what to do. If it helps, right? Now,
Can I just add on? I'm sorry, Dr.
please,
Lopez.
no,
Can I just
please,
do
yes,
a add on to that?
yes, absolutely.
So suppose that particular person went to the job and actually killed the person, right? And let's say they work night shift at a hospital and the state board of nursing is closed. Now I'm talking real life.
Yeah.
Are we liable because we didn't do a duty to warn, or
Did you follow the scope of practice within your state? Yes or no?
well, yeah, but if they're
Well,
closed,
if you follow your scope of practice, then you're good. If you didn't, then you're in trouble, right? So everything depends on the state that you work. So when you get your license, you need to understand the scope of practice within your state. And where do I find the scope of practice specifically? Don't tell me the states, but don't tell me the Board of Nursing, but which document?
which document we find the scope?
Right. Uh-huh.
The Department of Health?
No.
Help me out, guys.
Anybody can
The,
jump in. Perfect.
Yeah, Nurse Practice Act, correct.
Why is that important? Because sometimes you may not see
Sorry, I couldn't hear what was it again?
the Nurse Practice Act. What is the Nurse Practice Act? Well, it's a law, right, that varies by states, right, which is also known as state NPA, which generally establish details of your scope of practice. So that is important in so many ways, because if you're looking for a question about the State Board of Nursing and you don't see that, you may see the Nurse Practice Act, because it is a written document by the Board of Nurse that grants you the legal authority in the state to practice within the scope of your capabilities. So some states you don't need supervisions, other you do, right? It varies between each state, and then each state is different. Unfortunately, it is what it is, right? But you need to know your state, your scope of practice that is written in the Nurse Practice Act. All right.
So because it's a national test, and the answer will always be refer to the State Board of Nursing.
No. Always
Okay.
there is nothing in psychiatry that is always, okay? Let's clear that up. 100%. If you ever find absolute every time, always, you can cross that answer. I don't even care what question it is. Now, what else can you do in every state and you have the right to do that and no one can ever accuse you of anything?
Call the police.
You can. That is always a very good answer. So it boils down to calling the police or calling or finding more information within your scope of practice, right? Now, it does not mean that is 90% of the questions. Now, how about the 10% of maybe 15%? Let's say I have my patient, his name is Mike, and he comes to me and says, I'm going to kill John, and John is my other patient. And the question says, you have John's numbers, and you have John's information, and you know Jones, or you know, very settled, you know your state board, your scope of practice. You understand that the Tarasoff principle. So basically, the question is asking you, what is the Tarasoff principle in its ruling? Okay? So don't worry too much about it. If you see a question that says, hey, the Tarasoff principle is applicable, then you know what to do. You're not going to call the police. You're not going to call the State Board of Nursing saying, hey, it's applicable. Or if you see a question that says, hey, you know your state board regulations super well. Basically, it's telling you what is the Tarasoff principle, in other words. Now, these are far in between, maybe 10% of the time, 90%, 85%. Call the police, call the State Board of Nursing. Because these are two things you can always do. Get clarification, call for help. Okay?
Okay.
But
Thank
now,
you.
the calling the State Board of Nursing is even far, I would say it's 80% call the police, and you have these odd, ridiculous answers, such as calling the Board of Nursing. But hopefully now you at least understand the why, because of it defines what you can and cannot do, and you understand a little bit more. And that's why I say people that don't do a specialized course, they would say, they understand what the Tarasoff principle is, and they get it wrong, and they don't know why. But now that is a clarification. All right, folks, one more question, something about the board, and then I'll wrap it up real quick after that. Can I call the victim on the third case? Yes, because it says, hey, it is applicable in your state, or hey, you know your state board, and it is applicable. Yes. So that would be like the odd, very odd question, 5% maybe. And guys, you're not going to get tons of questions like that. You might get one or two, right? So it's good to know, but it's not like, even if you get it wrong, you still have a whole lot. So, all right, folks. So if there is no more specific question, good night to y'all. I will stay back just to kind of go through the course, the flow of the course for some of the people that are maybe having a little bit of hard time or want to understand a little bit better, or if you are new. But sorry, I thought I hung up. My apologies. I was like, I clicked the wrong button. No, I'm still here. So I just go through the course, but there is no more teaching unless if a question comes up. I don't want to waste your time if you are testing soon, but you are more than welcome to stay. Okay, I just want to go through the flow of the course real quick for everybody else that may have a question about it and kind of like feeling stuck or something. All right, so once you do not need a password, right? You have something called the magic link. All you have to do is click your magic link. So the person that said, I can't get stuck, I'm stuck on the home page. Do you want to put your password, your email address for me here? Do you have the schedules for August crash course review? I do not. We're actually finalizing to tomorrow. By next class, you will have it. Thank you, Joseph. There was somebody that mentioned that they were stuck on the course, right? All right. Do you allow me to use your email to work as you? Natasha, is that okay if I log in as you? I don't invade anybody's privacy, okay? Only when people ask me for, Yeah, I stay out of it. I don't want to, if you say no, then that's totally okay.
I look, I'm like, oh my God, I to put the camera on. I'm like, oh, geez, let me turn that off. But can you hear me? Yes, you can. So that's my
Yes.
email.
All right, Natasha, give me a second here. I'm going to log in as you, okay? So let me get your password here, and then I'm going to be Natasha for 5 seconds here. All right, so Natasha, once you get your magic link, you log in into the course. Let me kind of log in as you. 1 second. All right, so I'm logging in as you, okay? So I'm going to share your course, your environment. Okay, so this is that you. All right, I don't know if this is you. Let me double check. Yes, Natasha. Yeah, Natasha Rivera. Do you see it? Am I sharing? Yes.
Yes.
All right, so you are in the home screen. Where do you want to go?
I can't get to this screen. That's
Okay.
what I'm saying. Yeah. I mean,
right,
I can't
so
find it. So
If
I don't know where that miracle link
okay,
is.
no problem.
Okay.
So you can always go back and say magic link. All you have to do is click on it. You are here, right? So let's say it doesn't matter where you are. Click on home, and then you arrive to this page. This is home.
Okay. Okay.
It doesn't matter what course you are. All you have to do is click home.
Listen, I'm telling you, it never leaves. I keep clicking home, home, and it stays in the blue page.
Okay.
I don't know what's going on.
Completely shut it off, turn it off your computer, and try again. Because I can give you a magic link right now. It will bring you to this page. So it might be stuck on your page. So I would recommend to shut it off your computer and then log back in.
So you emailed me the magic link.
Yes, on the first day that you joined the course.
Right. Okay. So I can't find that
problem.
email. That's why.
So Natasha, just send me an email. But the most important thing you do is shut it off your computer and log back again. Send me an email and then we'll go ahead and give you the. So once you get your magic link, right, you log into the course. All you have to do is follow this script. If you have the time, watch the video, and then this is your next course.
Right.
If I click here. Right, if I click here.
I watched the videos and I printed out the PDFs. I just want to go back and rewatch them, and now I can't find that. Yeah.
So if you want to rewatch anything, you go to all trainings. I go to all trainings, then I can select any trainings that I want and rewatch them. Let's say I want to do module 2. I just click on module 2, and now I have all the trainings that I can rewatch. So the reason why we show one training at each time is to make sure you are focusing on one thing every time, right? So if I click on one training, then it should kind of come back. And if I watch let's say I watch this training, let's say I watch this now. Then after here, you see the next training up. Then this would be your next training for module 1. You watch that, and then you go to the next one, which will be right here. And then you keep going. I don't want to click so that doesn't disturb the flow of your training. And then you do that all the way through the last video. When you get in the last video, you do the question bank. So I'll go to all trainings here, just so that way I can get to the last video. And then I click here. I'm just simplifying because you would go one by one, right? Then now it is your last training for module 1. When you get here, you simply click here, then a window pop up and says, hey, what is your password for your question bank? And now you complete, let me stop sharing, and now you complete your question bank. Log in as written, your email address and the password is there, unless if you change it. Now, folks, sometimes people say, no problem. Folks, you can change your password. How do I change my password without emailing Dr. Lopes? Well, if you go to the question bank and you're like, darn it, I can't remember. I want to change my password. All you have to do is go here, forgot my password. All right. And then you can change your password. Now, if you change your password, it does allow me to still look at your stuff, but I prefer not to, right? Because I keep things separated, unless if you give me, authority to look at your stuff. Otherwise, I don't. I mean, we're looking for patterns. We're looking if you're doing your work. We're looking somewhat your grades, but we're not going to in detail looking, hey man, you got this question wrong. You should know this, right? So you can always reset your password and you're good to go. All right. Last question, because otherwise it's going to drag a little bit.
Treasure. Treasure. That's Treasure. Dr.
Hey,
Lopez.
Treasure. Hi, how can I help you?
Oh, yeah. I just wanted to notify you. I did email you, like I don't really, do so much multitasking. So I still have schoolwork and I'm not texting like anytime soon in the next 30 days. So that's why you don't see me, because I got your email, but I have already written you before that. I just want to notify you.
Yeah.
So my friend and myself, we are not testing in the next 30 years. We just want to get done with school and then we will embrace this. So we'll let you know.
Yeah. So
Yeah.
the system doesn't allow me to put exceptions, right? So it's all or none.
Okay.
So you will, because we have 2 employees that all they do is look at your data, generally
Okay.
speaking, right? So if they see that you are not engaged, they tell me, and then I send an email. So we can't say, oh, she's in school, that's why I just, is all or none kind of situation. But just
Okay.
don't worry about it. You know what you're doing. I don't want to lose anybody. That's the
Oh, okay. Thank you so much. Appreciate
all
it.
right. Thank you.
All right.
All right, folks. Last 2 questions. Let's go with Yushi. I know you're new and you told me your name. My apologies. That is not your name.
Yes, yes, sir. It's not my name. I just used that for my
Okay.
email.
All right. How can I help you?
Okay. I haven't started, like I said at the beginning. My name is, by the way, Hilal Omar, so you should have that, but my email is this.
Okay.
Couple of questions. I'm trying to organize myself. I haven't taken my pre-diagnostic, which I plan to do it tonight after this session.
Oh, you should probably do it tomorrow. It's gonna be a long night for you.
I have an infant, so I think
Okay.
my schedule works better at night. So
Okay.
I plan to do it, but it's been 2 years since I've been in class.
Doesn't matter. Okay. So we have had people that graduated and didn't take the board 4 years later and still passed the first time. So it does matter, but at the same time, don't let this hold you back. If you graduated 2 years ago, we can work with you from the ground up. As long as you do the work, you will pass. Don't even care what school you attended. Okay.
Yeah. So the thing is, I didn't actually graduate. I finished the classes and I waited to graduate because I was thinking more of my resume in the end. So life happened and I just postponed it to submit my graduation intent to graduate form. So my graduation process is going right now. So my class will be this year. Yeah.
Okay.
However, my question is, one is the schedule for life classes, because I intend to come to them because I don't have that. My second question is, since it's been a long time, should I dedicate most of my work and organize myself around your content, the PDF, the questionnaires, or should I focus more other resources like the Purple Book that a lot of people talk about it? What is your input from that perspective? Because I have everything I need. I just don't know where to focus. I don't want to be all over the place through panic.
The course in itself has more content than most people can really grasp. So you should not look at anything else. And I'm not saying other stuff is not good. What I'm trying to say is that what you need to pass the board is right here. Now, let's say you want to know more about cluster B. Let's say cluster C, anxious personality disorder. Well, we don't cover that much, but you want to know more. Then you kind of can search it up on the Purple Book and so forth. Now, the reason why we don't cover is because it's not likely that you see a question on it. You could, but it's not likely. So what we covered is exactly the most high yield content. And even though it's condensed, still a lot. So spend your time wisely. That's my suggestion. I think you can read all kinds of books that are good, and preps and things like that. They're good, but they may not be the best use of your time. So I would say primarily focus on this, master, and then after that, if you got the time, do anything else that you feel like that may be helpful. There is always something to learn. Just even if it's not for the board, there is always something to learn from everybody, right? So, and what I say is, if I open my email right now, I have at least 3 or 4 people that email me today and say, I didn't use anything other than your course. Every single day I get this, every single day. So that should be approved. As I mentioned here, how many people have tested? I earlier showed you guys 7,000 people, right? 7,000. So, this is not like people talking, 99% passing rate. So I'm like, show me, right? Show me. I show 7,000 people. We have the records of 7,000 people, students that took our course and their grades and how they passed or how they didn't. So we try to make it condensed, but not too condensed that we would be missing a lot of things, right? So if you do the course, you don't need nothing else. Now, if you're curious or want to add a little bit more or just want to do it for practice, yes, absolutely. But it's not like a must for you to pass. Does that make sense?
Yes. What about the live classes and the schedule? Where do I have access? Because I remember somebody asked you about
Perfect.
August, and I'm assuming that you guys put it on the first of the month or something.
Yes. So when you joined us,
Today.
Okay, so look at the email that says, hey, welcome. And then at the end of the email should have a link for the live classes. Okay. But in
I've
summary,
received like multiple emails, so I didn't know which one is
no,
it. It's like,
I know. I got to talk to my website designer and be like, man, what are you doing? You receive it, and I receive 4 emails for each one that join in. So now you can understand that I have like
Wow.
over 20,000 emails, really 20,000. So if I open an email, I will never find it because it drops down to the universe. I don't know where it goes. So basically what I'm trying to say is that every week, generally speaking, we meet Tuesdays, Wednesdays, and Thursdays, 7 o'clock. You will receive a link 1 day to 2 days before the class.
Tuesdays, Wednesdays, and what?
And Thursdays.
So 3 days in consecutive.
Yeah. Now, on the crash course week, we don't have class during the week, but we have a 20 hours class on the weekend, which will be the 25th, 26th, if that is the weekend. Okay. It's 25th and 26th, yes. All right. But
My last question.
Yes, please.
My last question. I'm trying to organize myself to the best of my ability, so I'm just bumping on the questions, I guess.
No,
I
it's
listened
okay.
to I have listened to the orientation video last night when I enrolled, like this morning.
Perfect.
And I saw how you organize the study plan for 8 weeks, and it says one module per week.
Right.
So, and then I went to the website and they said the exam is categorized into 5, where there's a 40% for one category, 30. So would your modules be in alignment for the proportion of the exam?
Yes, to some degree, right? So there are 5 domains. We have 10. So we have 1, 2, 3, 4, 5, which are the same. Then what is 6? 6 is the crash course review. Then we have 7, 8, 9, and 10 is your full diagnostic test, right? But yes, we are not to the teeth as far as investing more time on module 2, but we can invest everything. We look at the whole blueprint and we say, what is the most important? If I'm writing this testing, if A&A hires me, what kind of questions would I ask? And this is exactly what is in your content. These are the things that I would ask. I write tests for a living for some universities. So these are the things, you know, some of you guys might have taken my test in the past too. So these are the things that I would ask. And it comes to be very close to what is written to some degree, right? Or taught. So if you follow the content, it's kind of like almost impossible not to pass. Now, if you take a break, if you don't do active recall, if you stay in the program for 4 months but not actively working, you're not going to remember what you learned in the first week. Now, just to emphasize you one more thing, sorry, I don't want to drag, but we suggest 8 weeks. Now, we have tons of people, maybe 1,000 people that have done it 4 weeks. The name of the course is PMHNP 30 Days Walk to Success. Your life may be different than mine. Maybe I don't have a wife and kids and I don't do anything, right? Like then I can finish the course in 4 weeks if this is all I do. But realistically, that is not the life of everyone. I would say that's the life of 1%, right? We are not it. We are busy people. We're working people. We have spouses and kids and life. So realistically, 8 weeks is still pushing, right? Now, you can adapt it for 10 weeks. You can adapt it for 4. If you want to do it in 30 days, all you have to do is cut in half and do as twice as fast. Allows you to do however you like. So
I was thinking to finish maybe, since I'm rusty on my content, more of 6 weeks. Then those last 2 weeks focus on questions, rational focus, and maybe I don't know. I'm still getting to know the program that I'm enrolled right now, but that's my mindset.
Yeah, as long as you are on it, you'll finish in 8 weeks. Now it's going to be, if you have a family and you have other commitments, it's going to be a little bit hard. But at the end, it all comes together. Okay, so aim for 8 weeks, maybe 10 weeks, anywhere there. I think that is the sweet spot. Too long, you are at risk because that means you're not actively working. I had to call some people out and say, look, man, you've been in a course for 6 months. What is going on? You better go test it, because what are you doing 6 months in a course? In a good way, right, everyone? I'm trying to help you.
I'd rather take the test when I feel like I've had cover everything and felt than stay in there for a long time and then doubt myself and lose my confidence in the content.
Exactly. So if you've been through the content and you worked through the content and then you took a 3 months break, you're going to have to go back to the beginning again. If you take 2 weeks break, you're going to have to go back. So it's important that you use intensity and focus, not so much how long you're in the program. Hopefully that's helpful. All right, let me get a few more questions here. I'll stop the recording just in case. All right, folks, we got a few more questions here. So, I'm not holding